So often in medicine and in mental health, we as physicians or treatment professionals say, we know what recovery looks like. It looks like this. It looks like this for all people. For anybody who has an eating disorder, it looks like this. Or for anybody who has a substance use disorder, it looks like this. Or for anybody who has PTSD, it looks like this. And that's just not true. It's just not true. There's a whole array of paths to recovery. What's recovery and someone's best life is unique to that individual.
And because I got into this based on my interest in really helping people find lasting change and create sustainable change, this model of looking at the whole individual instead of looking at the individual through the lens of just diagnoses. So taking the individual and saying, your eating disorder is very intimately related to your alcohol use disorder, that both have really, really deep and tight connections with your trauma, which is really what I think is the central piece to a lot of the conditions that our patients come in with.
Disease like this, addiction, trauma, it works like a whack-a-mole, right? Like, I'm going to stop drinking and I'm going to start eating. I'm going to stop eating and I'm going to start sleeping with everybody. I'm going to stop sleeping with everybody. I'm going to gamble my life away. I'm going to spend all my money. Because my disease centers in my mind, and it doesn't matter what I use. I'm always going to find something. That's what I love about SunCloud too. It's like, they're not just treating one thing. They're not just saying, hey, you're an alcoholic, go away. No, you're an alcoholic. Maybe you got these other issues. How does your life look here? What are you doing there? What have you struggled with before? What are you also struggling with? And how many times do we come and say, yeah, I don't have any of those problems. I don't want to talk about anything else. I've just got this. I only drink if you can just get me to stop drinking. And then you put away the drinking and you feel like all this other stuff is coming up.
I think that the emphasis and the focus on rebuilding healthy attachments, building community, making more connections, which is an integral part of treatment here, is a strength of the program.
We do not focus solely on mood disorders or solely on substance use disorders or solely on eating disorders or primarily on any one of those three things. We focus primarily on the patient, the individual patient, and what their complex disease package looks like, what their complex package of assets and strengths look like, and then build treatment plans to specifically tailor each patient's needs.
Right, and a big part of treatment is not just getting sober and staying sober, although that is a big part of treatment. It's setting up life to thrive and to have something that you're looking forward to. As one of my patients said, is like making a life worth being sober for.